It's 4:30.
Good evening to all the viewers and wishing you a very, very happy Shubha Navratri. Today we are at the seventh day of Navratri. I mean, a week has passed with this great celebrations. And I feel that, Saptami, the day which we are celebrating today, has a lot of significance. We have some videos made on significance, so you could go to our page and watch the videos of Banyan Minds. Uh, Nevertheless, what happens is that during this complete 1 week, women have been fasting, they have been going through a lot of hectic schedule, and similar things happen in their life throughout the 365 days. And in all these things, what she neglects the most is her internal health. So we had very good sessions on yoga yesterday. We had a good session on mental health, meditation, and how important healing is. All this was related to the mental health of the woman, of the society rather. Today we are going to focus on a very woman specific health. I mean, I call it a treasure. I mean, it's a treasure for her. But yes, there is a big there is a big responsibility which comes with this treasure, and she has to undergo this responsibility throughout her life. Now, this I'm talking about are the different stages in women's life and the internal development of her main system, which is the gynac system, of a woman, for which she is actually, known to give birth to a new life. So today we are going to talk about the journey of every single woman, whether she is married, whether she is not married, whether she has children, whether she doesn't have children. It's not about that. It's about that women who undergoes this puberty to adolescence. I mean, this cycle of hers, and then what happens after that, what are the challenges she faces and all that. So we really have a very good doctor on panel today, Dr. Rameshwari Patil from Bombay, and she is going to take us through a nice journey where what exactly happens, what should you actually take care of. And there are many technicalities also in this which a woman is not aware. What happens is, and post a certain age, there are certain things which a woman really has to take care of, and definitely Indian woman doesn't do that. So Dr. Rameshwari is going to tell us a lot on this. She has worked a lot in this field, about generating awareness about these subjects. Apart from her regular OPDs and regular work in medicine, she has also published a lot of articles in newspapers. Her lot of articles have been published in the Asian magazines about the subject. So we can say she's like a subject matter expert. So you can even ask her some queries which she can answer later on. Dr. Rameshwari Patil, welcome on board. Wishing you a very, very happy Navratri. And
Thank you.
we are really thankful to you that, in the busy schedule of medicine, you have decided to generate this awareness in every single woman from every strata of the society to understand her internal gynac system very well. So I would like to ask you that, after you introduce yourself, so you can tell us little about yourself. Can you just tell us these words like, puberty, adolescence, and getting your periods? So if you could explain us all this, it would be great.
Yeah, first, good evening to all the viewers and Shubha Navratri to all. Uh, I have been into this awareness programs and all because wherever I went, I understood that there cannot be changes if there is no awareness. I have a strong belief that awareness precedes changes. Okay. Whenever I used to visit any educated class people, also in the corporates or in the NGOs, I found out there are very many myths to be burst regarding women's health, and there are many changes, right? So that day, how this topic came up, basically, I'll share my journey as and when throughout the talk, but how this topic of puberty to menopause came in. That I was just going through my daughter's textbook, and she has a very beautiful poem by name The Bangle Sellers by Sarojini Naidu. Okay. So Sarojini Naidu ideally describes the Indian woman and what are the different colored bangles that she uses throughout her life, like as a young girl, as a married woman, and then later during menopause, or not menopause, basically as senior citizens or as a widow. So I was just that topic actually just struck my mind. Ki why not go through this and share and have a health talk, because many people are unaware what exactly happens in puberty. See, there is a lot of information on the net today, right? But the information should go in an appropriate manner and at the right time to the right person. Okay. So I thank Banyan Minds. I thank Mayura ma'am for providing me with this platform, because I have done many physical presentations as such in various corporate and NGOs. Okay, but this is a platform like I'm going live for the first time. So sorry for the delay. And we start. You asked the question, what is puberty and what is adolescence? Okay, these words are used synonymously. Basically, puberty is more about the physical changes, the girl child. Now we are focusing on the girl child, okay, female. So I'll just talk about the female pubertal changes because we are talking from puberty to menopause. So what happens in puberty is it is a transition from childhood to adulthood, and wherein she becomes capable of sexual reproduction. Okay. So the ideal age group for puberty is 9 to 15 years. And puberty always begins before adolescence, because adolescence will continue from age group 10 to 19, right up to the teenage, the 13 to 19 age group. Okay. And adolescence is more about the psychosocial changes which come up, the cultural changes which come up, the changes which we can understand. Okay, Marathi mein you call it as Pauganda Avastha, and in Hindi we call it as Kishore Avastha. That is what happens. So, what basically happens in puberty? You all know that we are mammals, right? So, the term Latin word pubers, okay, puberty stems from the Latin word pubers, means to grow hairy. So, it's just a kind of thing that you just grow hairy. Hairy means what? Yeah, as mammals, yes, you're bound to develop hair. There are many changes which occur during puberty. You see, and as puberty hits the females first, okay, the girls first, then the boys. You see, during in the fourth standard or fifth standard, you will see taller girls than boys. Okay, they have a growth spurt. Then the hips widen, the body becomes curvaceous. Okay, the body becomes more oily, sweaty, and all these things come up. And hair growth is there in the intimate areas, the pubic areas. Even the breasts start developing. Okay, basically, what goes after the pubertal changes start, the breast development. Okay, 2 years after the breast development, there is menarche. So what is menarche? As a young girl, I never found this word interesting. If it is related to females, why men should come in between? Why there should be menarche? It should be womenarchy, right? So, at the onset, menarche is basically the onset of menstruation. Okay. What happens typically from 2 to 4 years after the breast changes come in is you start with your periods. The first periods is called menarche, the first period that the female gets. There are a lot of changes also which occur at the pubertal stage, okay, and the adolescence change as such. You will find children getting irritable. Children, that sleep patterns will change. There will be acne spurts. There will be weight gain. But there are certain things which are happening. They are growing, and they are growing at a very fast pace, okay, which is difficult to handle for them too. This transition should go smoothly. So, what should happen? They should be aware that this is a passing phase, okay. What I appeal to all the viewers, the men as well as the women, or the girls and the boys who are saying it, you should educate the boys equally about these changes which happen in a female, because then they will be considerate enough. They will be considerate enough. Okay. Even they go through a lot of changes, okay, at certain stages, but then that is a different topic altogether. Then the bone growth will happen. It will increase in thickness, volume, brain development stages will be there. They will have self-control skills as well. And at times they will, that problem solving ability will increase, the decision making, and they feel that okay, now they are grown up, you don't need to interfere, right? They become, like, okay, I've grown up now. So they are in that phase where they're neither a child nor an adult, and this phase is very difficult to handle. I think the viewers will agree with it. I'm audible, Mayura? Just raise a thumbs up. Yeah. So what happens is this phase is very difficult to handle. So why are these changes happening? What is the science behind it? It all happens due to the play of hormones. Hormones play a very crucial role in this development. Okay. So what basically are hormones? They are chemical substances. They are naturally found in the body, and then they are secreted by the endocrine glands, and they will actually like stimulate specific cells and tissues, certain organs, and then the action happens on the specific site or throughout the body. Okay. So what basically is menarche now? As I said, menarche is the onset of menstruation, right? The first period that a male, a female gets. So this is a series of physiological changes which happens. Okay. So I will not use technical terms like the pituitary gland, the LHS and FHS that will promote ovulation and all. You can always find the diagrams of the female reproductive system on the net. And most of the school going children are aware of what is a menstrual cycle. Okay. So basically, there is certain hormonal increase in the estrogen, progesterone, and other things, LH, FSH, and all. And then it comes down when the ova is released, and it goes in the uterus through the fallopian tubes. And if fertilization doesn't occur, then the level of then it is shed. The endometrium is shed along with that ovary, right? Along with the egg that is not fertilized. So the level of estrogen and progesterones get decreased, and again the endometrium sheds. A very interesting term is used. Okay, it is called weeping of the disappointed womb, and it is so accurate. I feel, because when I explain about menstrual cycle or periods, as we call in local language or in any language, basically in local terms. Uh, I cannot tell them technical terms कि ये होता है वो होता है and all. What I say is, you are a girl, you're going to be a mother, you have a baby bag, but still you are small, right? So what happens? That baby bag craves for a baby, but since we cannot give you a baby to handle because you're quite young, you're quite small, so it starts weeping. Okay, and it happens every month. This is what has happened to your mom, to your elder sister, to your aunt, to your grandma, right? And once you are at an appropriate age, about 18 to be specific, or when you have when you get married, after you get married, that is how we explain to young girls, because we cannot explain all the technical terms, okay, to the females. And maybe, like, because nowadays what is happening is, you get a lot of girls getting periods at a very early age, so it's difficult to handle for them as well as the parents. Ideally, in when our times it was like the sixth or seventh standard, when some videos were shown in school about periods. Okay, they used to give us some sanitary napkins or something to use or something. You just show a demo or something like that, just a video demo and all. But nowadays what is happening is you're getting periods at a very very early age, a very early age, and that is called as precocious puberty. Okay, when puberty hits before the age of 8, and breast development starts before that age, and you get periods at the age of 8 or something, or just before that. So this is very rare. Okay, rare in the sense, rarely the cause directly cannot be it is like, you can pinpoint the cause, but there may be obesity, there may be excessive use of meat and dairy products. So that is one of the possible causes. Okay, because nutrition level has increased in females, it is not like earlier people. But the average age of menarche is 12 years, 12 to 12.5. But we take it from 10 to 15 years or so. Before that and later to 15 years, then that is an abnormality, and you need to go to the gynecologist at the earliest. Okay. So, and what are the complications of this precocious puberty? The word itself says that you have to be cautious, right? There will be short height, there will be social and emotional problems that the girl child will face. Okay. Now, how can you prevent it? You have to maintain healthy weight in a female. Okay, chubby girls are good, fat girls are also good at a certain age, but after some time, when it comes with these hormonal levels which go, like you work like tandem, and you don't know what happens, what disrupts them. You cannot just go and ये तकलीफ हो रहा है तो ये मेडिसिन दे दिया. Over the counter medicines are not recommended in this age group and any other age group, but it's always better you don't give them, over the counter medicines every now and then, and you promote and you encourage them to have a healthy weight. Like, you have to maintain that weight parameter is very important, because obesity is a precursor to many 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 other diseases. Okay, in females as well as males, but basically for females, yes, the problems that she faces in the future due to obesity are numerous. Okay, you cannot just cover it in one lecture, but I just wanted to know about this. So what basically happens in the menarche phase? Okay, the onset of menstruation, there are hormones which have come up. Okay, and how to, nowadays people know it. So what is an abnormal cycle? If you count from day 1 of the period, the 21st to 45 days, okay, between you, if you get your period after 21 days or up to 45 days, it is okay, normal, okay, adjusted. And the bleeding phase, okay, should ideally last from 2 to 7 days. Anything below that or beyond that is not good. So you have to, you can say, you have to consult the doctor at the earliest. The earlier the better, because I always believe that uh, ounce of prevention is always better than that pound of care that you take. Prevention is always better than care. That's an old adage, right? Which everyone knows, but I don't think people follow it. So how can menstrual hygiene be maintained? Yes, you can use sanitary napkins, pads, menstrual cups, or tampons as per your choice. Okay, we have a beautiful session tomorrow who's going to talk about menstrual cups and all these things. Okay, and you should use extra absorbent cotton pads. Cotton pads, yes, they are always welcome. And you should change your pads 6 to 8 hourly. You should have a light diet, a light nutritious diet. You should not have too much of, whatever you're craving for. You just start eating, then that will not going to help you out. Okay, and maybe antispasmodic medicines if you have too much pain. Okay, that that helps in some cases, because some people have a low pain threshold also, and initially it is very difficult to handle. And maybe having too much of abdominal spasms, uterine spasms and all, girls cannot handle it certain age. So this dysmenorrhea, or maybe can, actually is not good, and it hampers their routine, the daily routine. So you should change the pad 6 to 8 hourly. Plus, what I feel is, there are certain things like, hot water, warm water bath, hot water fomentation, which can help to relieve the pain of periods. Okay, and yeah, certain things like dark chocolates. just before period. I'm going to talk about that also. Just before periods, what comes up is the premenstrual syndrome. I'll talk about it later. So you can use bananas, you can use dark chocolates, you can have that if you have that food craving for chocolates and other things else, okay. And one thing I want to point out about menarche is, since the incidence of brain breast cancer is rising at a fast pace, okay, what I feel is self breast examination. Every girl after she starts her period should be made aware till the her period stop, okay, till the menopause phase, or later also, but at least till menopause. Once her period start, she should be aware what is self breast examination. Okay, you can find the charts and all, you can ask your doctor and then they will show you this. It's done every month, basically after the end of periods or the fifth day of periods, okay. So for all these things, one thing is for sure, you have to befriend your daughter, your elder sister. Maybe, I don't know, the elder sister should befriend the younger one, your mother, or anyone. So what happens is you have to tell her the relation between this menstrual cycle and fertility. Okay. And the thing which we don't want to talk about, but consent for sex, because that will avoid all future problems. Okay. And there are many other things which we have to take care during puberty. I'll also tell you about certain, you can say, what care you can take during puberty. Okay, you have to shower daily, maintain that hygiene and all. It's fine. You can use cotton socks because you tend to sweat a lot during these changes. Okay, and you wear light clothes. You can like avoid binge eating also, because binge eating is a very common problem. And dental care also you have to take, because dental care is directly related to the digestive system and everything else, the whole body. I see a lot of people, because one thing about puberty is you try to sweat, like sweat a lot. Okay, you sweat a lot. Maybe there is more of physical activity also, and then the hair growth is there and you sweat a lot. And what happens is there's a potential body odor as you sweat a lot, and the bacteria thrives on it. Okay, many people do incessant use of, you can say, deodorants and antiperspirants. So deodorants always better than antiperspirants, because if you use antiperspirants for a long time, what happens is you're blocking the sweat glands. Okay. And what will happen if you block the sweat glands? Because the sweat is actually an excretory thing which is coming out, right? The body doesn't need it. It needs it for temperature regulation or flushing out the toxins. So these things are there which come up, and antiperspirants, try and avoid using them. Always have a, like a good bath, and dry that area. Always better. Rinse it very well so you feel fresh, and you can have it twice a day or as per your requirements or whenever you are dirty, right? So I feel that this things always helps, because antiperspirants I personally don't recommend. Deodorants, yes, nowadays everyone uses it, so they can use. But see whether you don't use a strong one, or don't use it regularly. If you're at home, don't need to use it, like once you shower up, or you're at home, always better not to use it. You've been sitting in the AC every now and then, I don't think you'll hardly sweat. And antiperspirants, yes, better to avoid them, right? And what I recommend is it, even the body hair, the pubic hair or the hair in the intimate area, that has n number of functions. Okay, they are very natural. So it is a personal choice whether to shave it, go in for lasering or trimming. That is a personal choice. Okay, because it has some functions in the body. It is a protective thing. Okay, now, many people use cosmetics also every now and then, especially females, they use a lot of cosmetics. So, you should clean, remove it properly. Otherwise, you land up with many skin problems in the future, and even that age also, pubertal ages. Okay, you're damaging your skin, and you have to engage in some kind of physical activity that actually helps you to maintain your weight. Okay, maintain you physically also, you feel better, you go for a walk, you do some cycling, swimming, or any sports activity. You have to take up a hobby. You have to cultivate it. Okay. And the best part about growing up is, yes, you're growing up. You're neither a child, you're neither an adult, but you have to enjoy this phase. You have to learn to accept, you have to be aware of the changes that your body is going to. And you should be sure that, okay, these are for my own good, right? I am growing up. I can take decisions. I know. And each one of you is unique and beautiful in his or her own way, right? Whatever media shows, okay, that limited edition things they show, that can be photoshopped or filtered or anything else which goes up. But what I feel is, it is different from the reality. So you should be aware of it. See, everyone is not that beautiful or that thing, but you cannot have beauty parameters, okay, to judge, because we all come in different shapes, sizes, complexion, everything, right? So I feel I have answered whatever you can say the puberty and menarche phase goes up to. Uh, Over to you, Mayura, for any questions which are coming up. Hello. Next question. Hello. Hello. Yes. I should go on mute.
Rameshwari, can you hear me? There was some internet error, so there was this disruption in between. Okay, Rameshwari,
I can't hear you, Mayura. You're not audible. बोल.
Rameshwari, can you hear me?
Yes, I can hear
Hello.
you. Yes, yes, I can hear you.
Okay. So Rameshwari, sorry, there was some internet disruption. So we continue because I was asking you that nowadays we hear this lot of terms like PCOS and PMS, and they are used so frequently. But like in your earlier thing where you mentioned, that what is puberty in Marathi. So what is puberty in Hindi, like the Kishore Avastha. So similarly, these terms of PMS and PCOS and PCOD, I mean, so many terms, So if you could explain to the viewers in a simple language, it would be a great help.
Yeah, sure. So we talk about PMS first because we have just talked about menarche, and it's very natural to get PMS, the premenstrual syndrome as they call it. It is a set of symptoms which occur after ovulation, like after the 14th day of the cycle. If you say it's a 28-day cycle, and first day of the period is counted as day one, so 14th day of the cycle after the ova is released, okay, till you get your periods, or throughout your periods, not till you get your periods basically. And this happens, and it is worse 4 days before the periods, the onset of periods. So what happens is basically the cortisol level increases in your body. The stress hormone cortisol increases in your body, and the serotonin decreases. The level of serotonin decreases. So this basically, what problem it has is you start feeling very low. Okay, you're unreasonably, you feel weak, fatigued, you have nausea, vomiting, not all the symptoms everyone will be having. There is bloating, okay, abdominal bloating which comes up. You some few females will have, few girls, females will have, because sometimes the period is absolutely normal, not everyone will get it, but nowadays we can hear that it's more of a thing that which is coming up. They have change in the bowel movements, some may have diarrhea, few may get constipation, and there are abnormal food cravings, there are mood swings, irritability is there, the depressive thoughts, they feel unreasonably sad. I don't know, they don't know the reason. I'm feeling sad, that is what they say, okay, but they don't know the reason for it. And they have that tiredness which is coming up, which increases. Plus you can also see that there is breast tenderness, okay, they feel that the breasts are heavy and tender. So this PMS, or the premenstrual syndrome, this actually worsens with age. And in females who have PCOS, what is PCOS? PCOS is polycystic ovarian syndrome. I'm going to talk about it immediately after this. And even if there is endometriosis, or maybe there is inflammation and this of the endometrium is the inner lining of the uterus, okay, so they may have severe PMS. Otherwise, all these things, headache, food cravings, diarrhea, constipation, bloating, all this comes up. So what can be done to handle this PMS? Someone else is speaking. Hello? Hello? Yeah.
Yeah, no,
So what we,
Rameshwari, you continue.
yeah. So what will happen? How can you handle this premenstrual syndrome? Okay. You should actually keep a diary. You should have a calendar or a diary. You should note down the dates of your periods, and you note down in that diary what trouble you have. Okay. So you know that there is a pattern, certain pattern. So basically, girls can predict, females can predict their periods. Okay, I have backache, I'm feeling low. Okay, I'm going to get my periods. That is what all girls say. Yes, right. Because if you maintain a diary, it always helps. कि क्या खाने से तकलीफ हो रहा है, कि क्या करने से हो रहा है, क्या करने से आराम हो रहा है. But generally what happens is we tell the female to stay active, okay? Stay active and have a light diet, and stay active and a balanced diet, so that it doesn't that gives comfort with that bloating part of the abdomen. If you are very you lead a sedentary life, it's very difficult. And then you should have frequent small meals every 2 or 3 hourly. You should have enough sleep, 7 to 8 hours of sleep. You can try yoga at certain age after 12 years. Yesterday, as the yoga hub mentors, okay, the yoga hub owners, yesterday who were there on panel, they told that you can start yoga at the age of 12, right? So Surya Namaskar and all these things come up, but not this, but meditation, Omkar pranayam or pranayam at an early age, so that instills or inculcates that value of a healthy lifestyle. Okay. And again, the intake of banana, maybe avocados, dark chocolate because it is rich in magnesium. Okay. Then adequate intake of the vitamin D, the calcium, the B6, and the vitamin E intake. Vitamin D, E, vitamin calcium, and a B6 intake should be adequate. Because what I feel is people like children stay at home. They are not at all exposed to sunlight nowadays, especially in the pandemic. This has happened. But otherwise, also they sit in closed rooms. They play video games. They are online, but physical activity has come down to a minimum. So don't do that. Ensure all these supplements also go in place. Not supplements basically through food, but vitamin D needs exposure to sunlight. And even iron deficiency anemia, that should be kept at bay at any age, because iron rich foods like green vegetables or anything else, you have to take it. Even calcium rich diet, like it is sesame seeds or many other things which come up. And what you can do is to maintain the electrolyte balance during menstruation and during PMS also. You can have a glass of lemon juice, okay, in normal tap water, not chilled water as such, but you can have it. It's always good to have that dose of lemon juice every day. Okay, unless you are allergic to something else, or maybe you can say you cannot do with lemons. But basically, females like khatta cheese, as I have observed, and it goes naturally. And yes, a warm water bath and hot water fermentation always helps. Now, when we talk about these things, yeah, PMS, not every female will suffer, but whenever you suffer at any age group, it may start. But you can always help with this. And medicines, if you can, for headache and all, you can take. But please consult your doctor or your gynecologist before doing it. Because incessant and irrelevant use of any over the counter medicines is going to harm your body in the long run. Right? Now, talking about
Yeah,
PCOS.
Rameshwari.
Hmm.
Yeah, so doctor, one thing I would like to tell you the audience is that these terms, no, which we use specifically, the PMS and PCOS, you told the full form of it. I agree. But if I have to convert this into a local language, or maybe I have to tell my maid, or if I have to educate her about these things, what would be that quick and easy thing which I can tell to the maid.
नाही, you can say कि in Marathi you can say that पाळीच्या होणारा आधी होणारा त्रास, ओके, या जो पीरियड्स के वक्त के पहले जो तकलीफ होता है, which is worse 4 days before the periods and gradually decreases in the first or second day of period, it will go because then the flow starts, and again the changes take place. So period has its own pain and all, but obviously this can happen, and you can give these small tips to them, and it will help in the long run also, because medicines will not help you in the long run every now and then, right? So talking over
Correct.
about polycystic ovarian syndrome or the PCOS thing, that is a leading cause of infertility now. This is the leading cause of infertility, the polycystic ovarian syndrome. Okay. So what basically happens in this condition is the cyst, or you can say small fluid filled sacs, okay, fluid filled sacs, they develop around the outer edge of the ovary, okay, and then they will have those immature eggs, and so the follicles or whatever, like that they will not be able to release that egg at a proper time. That ovulation doesn't happen on time, right? And this leads to irregular periods, or maybe you bleed for a longer time, more than 7 days. Irregular periods you will have. You can say uh, Beyond 35 days, you need to investigate if it happens in the long run and there is weight gain and all such things. And it is more common in obese girls, okay, obese people, girls actually, because PCO is diagnosed maybe at the start of the first menstrual period, or thereafter maybe you will have a short term of regular periods and then you start, like with PCOS. There will be irregular periods, then the sonography and all other investigations, I will obviously say, and there will be excess, there will be weight gain, they will feel lethargic, and there will be excess facial and body hair which develops, okay. And there may be male pattern baldness also, the male pattern baldness which comes in there at at a young age. It can happen due to PCOS. And obviously, it is more seen in people with obesity or females with obesity. And you have an acne spurt. Some females also complained about excessive body and facial hair. Like, on the ear also they may have it, on the upper lip that they have. Okay. All external things can be done to change your appearance. But what about the things which are going on internally? That needs to be controlled, or maybe that needs to be tackled first, so that the outer manifestation, which is whatever is manifested on the skin or through your behavior, comes up. Because PCOS will have that complications, like miscarriages, infertility, pre-diabetes, anxiety, depression. You will have eating disorders. You may have increased risk of cardiovascular diseases as you it's, and it also develops insulin resistance. Okay, so what happens is it can be hereditary, and basically you have more of the androgens, the hormones. Okay, and that is why this is happening, but you cannot pinpoint a cause. So what happens is you may develop insulin resistance. So what in many females at a young age, you can see dark patches, dark black velvety patches under the lower area of the neck, in the armpits, or in the loin, right? So people use scrubs. People use scrubs. They do facial. They do n number of bleaching and all they can do, but that is not going to solve their problems. Okay, what you need to tackle is the weight first. The weight is very important. The weight management is very important. So what we actually investigate to diagnose it as a PCOS, first, how, when will you approach the doctor if the daughter or any female has irregular periods, or maybe she is not you can getting pregnant, okay, she has a problem of infertility, so they will approach, right? So we measure the hormone levels, the LH, FSH, prolactin levels, even the cholesterol and triglyceride levels, and even the glucose tolerance, because then you have to see about the insulin resistance. And the best thing is the sonography, which actually reveals the enlarged ovules and the number and the cyst. Okay. And then there are gradations. If you diagnose it early at stage 1 or 2, basically people come at stage 2 or so. So it is easy to tackle it. Okay. And it's not that all PCOS females land up with infertility. No. Diagnose it in early age and in early stage. Females with PCOS are enjoying motherhood, okay, and will continue to do so. But for this, you have to make certain lifestyle changes and weight control along with medications with the help of your doctor and the dietitian. I promote, or I have inculcated this habit in a daughter, to have more of home cooked food. Once in a while, eating outside is good, but it's always better to have home cooked food and a diet which is locally made, locally available. It always helps to manage weight, and a simple walk, a 45 minutes, a half an hour of brisk walking helps to keep the weight in check. Even in normal females, it's not that everyone will have all the symptoms, excessive body hair, weight gain, this, that, irritability, and all. But it's always better that if you see such symptoms, you go in for a checkup and tackle it. Okay. Now, infertility, yes. Since you're talking about PCOS, I feel that infertility, yes, in short, I'll explain what is infertility. Yeah, failure to conceive, right? To get pregnant. There are innumerous causes, like n number of causes. But what I feel is if you are diagnosed with infertility after 1 year, 2 years of marriage, of having sex regularly with your partner, you have to do a infertility workup. You have to see a gynecologist who will do all the investigation checkups, the hormone levels, the sugar levels, the triglyceride levels, the sperm count, everything comes up. And you have to go with your partner only, because obviously you both are going to be parents, not the female only, right? So you have to go with your partner and tackle this issue. So, and at an early age, it's always better. Okay, people do use family planning methods, and it is that is a personal opinion, but that cannot go in for a longer period of time, right? Yeah, I think I've answered your question, Mira. Anything else to answer, or the next stage
So
we take up?
Rameshwari, yeah, I mean, obviously, I mean, like you explained here so well about all these things which are, responsible for a woman's, fertility, and then she becoming a mother.
Yes.
But what happens in Indian context is, there are a lot of taboos when it comes
Yeah.
to, going for testing, and then
Testing.
both of them going for a testing. So here I would really like to tell the viewers, like Dr. Rameshwari said, it is extremely important that when a woman, forget a woman, even the first stage which Dr. Rameshwari explained, puberty, so it is very important that the males in the house, so obviously it is the dad, it is the brother, they also play a very important role in this, because understanding a woman during this stages, of her physical change is so important for the male member. And the similar message has to go to the society, that at every age a woman has to be looked differently by the society, by the family, because internally she's going through a lot of changes,
Yes.
and as the doctor was explaining, these changes are so they look so minute to us when we actually talk about
Yes.
it, but internally there are major things happening, major
Yeah.
shifts happening inside the woman. So yes, her diet, then her habits, her lifestyle, her working patterns, all this are going to affect her internal health, because at the end of the day, these are such sensitive issues that, if anything goes wrong in these systems, then it is about the pregnancy, then it is about becoming the mother. And we know in India, these are these are the biggest social hurdles which even a woman today is going through, being a professional, or being from any strata of the society. Everybody is going through a similar kind of a story. So Rameshwari, now if you could tell us, that once a woman is pregnant, or when she's going to start her journey of pregnancy, so maybe pre-pregnancy, what are all the things she should look at?
Yeah, see, we are talking about the most amazing time of every female's life. You know, pregnancy is such. Okay, you have to enjoy that journey. Begins. You know, like you embark on a journey to motherhood. The time you are pregnant. So when should the urine pregnancy kit? The kit is available over the counter. When should it be done? Basically, it should be done. It should be done at least 10 days after your missed periods. Okay, if you are having regular periods, at least 10 days, because the UPT. Otherwise, you will get a negative report. You may get a negative report, because what happens is the UPT is positive. The urine pregnancy test, as you say, I abbreviated it to UPT as we call it. The UPT is positive due to the increase in the HCG hormone, the human chorionic gonadotropin hormone. I'm using it the shorter term, the HCG hormone. Okay, and this HCG hormone will rise around 7 to 12 days after the fertilization occurs. So, and then rapidly it will increase every 48 hours. So for that, you should do the urine pregnancy test at least 10 to 15 days after your missed periods. Otherwise, what happens? You will feel that it is negative, and you continue so. That should not be done. And I appeal to everyone, I can to the viewers, that you have to enjoy this time despite the morning sickness, the frequent urination, the unexplained fatigue, and the abnormal food cravings also that females have during these times. Okay, so now what actually has to be done during pregnancy is, gynecologists actually start with the folic acid supplements and other things, because they play a key role in the development of the fetus, the neural development also. Okay, so you have to go to your routine checkups and health checkups, investigations, whatever is there as advised by the gynecologist. Plus, you have to have the ANC profile done, the antenatal care profile done. In few or most of the things, the sexually transmitted disease, the virological markers are done, the torch agents are done. Okay, so TSH level, the blood glucose level has to be monitored, because many people nowadays have gestational diabetes, the diabetes which is first diagnosed during pregnancy. It is there, the raised blood glucose level is throughout the pregnancy, and once like the female delivers, the sugar comes down to normal. But then that is a precursor, you may have diabetes later in life. But this gestational diabetes harms the development of the fetus. So you just can't eat and sit unless you are, advised bed rest by your gynecologist and you have a bad obstetric or a pregnancy history. You have to maintain your health. You have to be very particular about this phase in life, and you have to do the, apart from the routine vaccines which are there, which every female will take, because nowadays people are educated about vaccination. Yes, about the COVID-19 vaccination which was given during pregnancy, yes, people still take it. If they have not taken it earlier, or maybe they were 18 before and now they have taken it, you don't know. But during pregnancy, yes, the COVID-19, the influenza vaccine if it is in season, even the tetanus vaccine, the TT vaccine as we call, and other vaccines as and when required. But these three are there which are given. Okay, and then you have to check for severe pain in your abdomen, maybe vaginal discharge, maybe spotting or any other discharge you get more, or fever, or abnormal swelling in the feet and hands, or anything else. Because if you have bad obstetric history, these are warning signs. Okay, there is something impending, there is something which is coming up, and this is not good. You have to be extra cautious. And yes, bed rest only if advised by your doctor. You can go for bed rest. And but rest is required. Iron rich, calcium rich diet is required during pregnancy, after pregnancy also, and before pregnancy also. You cannot keep iron aside. You have to be strong, like iron, right? Yeah, and when you pass through these phases, you go into a routine checkup, the sonography also, the malformation scans are done in certain cases where there is hyperemesis due to increased thyroid levels, or maybe certain other hormone changes. Hyperemesis is increased vomiting, that certain females have. Maybe people develop thyroid or borderline thyroid levels increase, hypothyroidism, and they get carpal tunnel syndrome, wherein the hands swell. Okay, there is a little bit of disorder, like they cannot have a good grip and all. So that helps, and there are many other things which can be tackled at the doctor's level only. You don't have to use your brains, because what happens is you hamper the growth of the fetus in your womb. And since you are carrying that fetus in your womb, you are actually damaging your own precious body. Okay, now your doctor is the best guide, who, like, whether it should be a normal delivery or it should be a c-section or a cesarean section. Hydrobirth and all is coming up nowadays. It is there because it relaxes, water relaxes the muscle, and people deliver through that way and all. There are many other ways, like normal and cesarean is basically the broad terms that is used. Ki operation झालं की normal delivery झाली, that is what we ask the males. And children, females do prefer, like, even as this c-section is done, but in certain cases. So let the doctor be the best guide. If there is deceleration or there is some heartbeat, like NST shows deceleration, I'm using certain medical terms and all, which the doctor will say, maybe there is some meconium aspiration, or the liquor is less, like the amniotic fluid is less in your bag. So there is that shock absorbing fluid which is less in your uterus. So the baby cannot descend down. So there are certain other things wherein you land up with an emergency C-section also, or an elective C-section if normal delivery is not possible in certain cases. So the doctor is the best guide. Okay, you can discuss it with your doctor. You have to have a good rapport with your female, with a gynecologist, whether it is a male or a female, whatever are comfortable with. But you have to go through this phase in a very, very optimistic manner, and that is very important. Okay, now what happens post delivery? Okay, you are into that baby care mode, right? You don't look after yourself. But some people land with postpartum hemorrhage. They have tremendous amount of bleeding, up to 6 weeks, 8 weeks, lot of bleeding, and that leaves them weak. So yes, and many people who don't breastfeed, because breastfeeding has its own advantages to the baby as well as the female. People who don't breastfeed, okay, at regular intervals, or maybe they are in a hurry to join the office. I strongly desist from this fact. You should not be in a hurry. You should enjoy this phase because it is once in a lifetime experience. Like, people don't have two kids, three kids nowadays. People have a single child. So always better that you enjoy this phase of motherhood, because this is the best time to bond with your baby. Breastfeeding is a very good thing which comes up. You are providing enough nutrition to the baby. You are actually, passing on fat. So that is a best thing for fat loss also. So that way I explain to my female patients who say that Array, breastfeeding nahi, fat loss will happen, nutrition will go, and you will have a good bonding. Because if you don't breastfeed for a while, you may develop milk abscesses in the breast, and they are very, very, very painful. Okay, you may need to drain it, and that is a very bad procedure for the females. Or many females who undergo this, if they share your experiences, you will say nahi nahi, breastfeed hi karte acha rahega, because it is contributing to the good health of your baby as well as the female delivered. Nutritious diet, breathing exercises, regular follow-ups will always help pre, post, and pre during pregnancy, during labor, and as well as post birth. One thing which goes up is lactational amenorrhea. That means you're breastfeeding, you have not got your regular periods post pregnancy, okay, but you conceive again, and that happens in a few cases. Okay, that is when you have lactational amenorrhea. So you don't know because you have not missed a period, right? You have not got a period after birth of the baby, so you don't understand whether you are pregnant or not. Okay, so better to, have self control and avoid a certain avoid contact post pregnancy, immediately after pregnancy. So it always helps for the recuperation of the mother as well as the child. And yes, motherhood is a very, very, you can say, an amazing journey, because you experience heaven and hell at the same time, they say. You break down when your child doesn't listen to you. You break down when he doesn't study, or maybe, like, you have to scold him every now and then, push him a lot. All these things require your good health. Yes, and they contribute to your stress, plus plus plus, right? Once you become a mother, you're not that carefree thing. So post this, because there should be spacing between the children, you have to discuss about various family planning methods with your doctor. Okay, and during all these stages, you have to get your anemia profile done. The vitamin C and D levels should be moderate, you have to uh, judge these parameters, and, like, you have to check it out. And even other parameters like CBC, hemoglobin, all these things come up. Because if you to enjoy motherhood also, you have to be strong. You have to be strong, because you have an added responsibility of the baby with you now. Okay, and the baby's health is associated with your good health, right? And now, through these things, when the baby reaches, I think, 10th standard, 12th standard, or maybe reaches school, some may have late pregnancies, uh, you go in through a very important phase. So, Mayura, I think I have explained a lot about pregnancy. Any other questions?
There are two questions which we will be taking at the end of the session. But now I would like you to, actually, I mean, I should not say that way, but yeah, I mean, it is now the last phase of her life where, there is again a big challenge which stands in front
Yes,
of her,
yes,
and
yes, yes.
that is your, menopause. So, if you
Yes.
could tell us, why this stage is arriving in some women's life nowadays quite early, what should be the natural age for this stage, and what are the challenges a woman goes through? So, if we can quickly, talk about this, it would be of great help.
Sure, sure, sure. See, basically, nowadays it is arriving early, but then you cannot specifically pinpoint why it is so, because children are getting it also at an early stage, right? What basically happens is the perimenopausal, like this, the years, a few years before menopause. So, what basically is menopause? Menopause is the cessation or the stop of menses. Your menses stop. And why do they stop? Because your ovaries are exhausted, right? The eggs are exhausted. Whatever stock you had of eggs is exhausted. Plus, you have a low estrogen level. Okay. So what actually happens during menopause or the perimenopausal ages? You have those perimenopausal blues, there are so many changes which happen. You have a poor body image because you tend to deposit a lot of fat in and around the hip area, the abdomen, everywhere else. You become moody, you become irritable, okay? And maybe, like period doesn't stop. In some patients, like some females, period stops abruptly. They will not get it and then they are okay with it. They may not experience any difficulty as such, okay? In some patients, what happens is in some females, there will be less amount of bleeding. Maybe they will bleed for a day or two, okay? And in few, maybe they bleed at like that, there is a delay in periods. 40 days, 45 days, they will start getting irregular periods during this age, 40 plus, 45 plus, okay, as an ideal age. Yeah, stopping periods, period at around age 35 or below is called as early menopause, okay? That ideally should not happen, because even these hormones, they contribute to your heart health, bone health, okay? Estrogen does contribute to your heart and bone health, more of this. And yeah, so what happens is the estrogen hormone will decrease, okay? The serotonin hormone will also decrease, the serotonin levels will also decrease, and you will have irritability, anxiety, sadness, fatigue which comes up. You will have as the collagen secretion also decreases at this age. What happens is you will have sagging, sagging of the jawline, the breasts, okay? So all these things do come up. Even the neck and the cheeks will sag down. You can start your skincare or whatever physical appearances you want to change at an early age. People do go to the salons and parlors nowadays. Everyone goes, most of them go. But what happens is the internal changes will contribute to the changes in appearance. So you can keep it, you can delay it, not directly change it. So, first and foremost, you should accept the fact that these things are quite natural. See, and you should be aware that these things are quite natural, right? And since your metabolism also slows down, I feel, and many people, yes, many people have this hot flushes, right? Hot flashes. I think that is a very common problem nowadays. Hot flashes. You feel that heat, that discomfort in your upper body, like face, neck, and all, and then it actually spreads through the lower down. So there are many things which can happen during perimenopausal, menopausal, and postmenopausal things. Okay, you tend to have an increased risk of heart attacks since the estrogen levels are low. So cardiovascular health is also this: heart attacks, stroke, even osteoporosis. The density of the bones decreases, so you are prone to get fracture. I see many patients, many females of 40 plus, 45 plus age group, बाथरूम में गिर गए, फ्रैक्चर हो गया, ये हो गया, फ्रैक्चर हो गया. But why should you land up with these things? It's always better you maintain your vitamin D levels, calcium levels, and other levels also. So acceptance and awareness is the key to tackle this phase in life: the perimenopausal, the menopausal, and the postmenopausal blues, as I call it. And you should avoid alcohol and spicy food items also, because that caffeine also, the caffeine and the alcohol taken in moderation, or you can say very less quantity is okay, but spicy, too much of spicy food, even caffeine or alcohol, even tight clothing or smoking can lead to increased hot flushes. And yes, obviously your cardiac health is impaired with the smoking and alcohol part, as you all know, right? And now what happens during this is, since your estrogen levels are going down, okay, you cannot directly go in for the hormone replacement therapy and all. Okay, that is in extreme cases that people go through. Yes, that also helps, obviously, but you can use, estrogen rich foods like dry fruits. You can have apricots, dates. Okay, you can have sesame seeds, तीळ आपण ज्याला म्हणतो. Then you can have garlic, good amount of garlic in your diet. Okay, you have berries, you have wheat bran, and you can have these sprouts and all also, good protein, and this which is nutritious. You can have flax seeds also. So these are all estrogen rich foods which contribute to maintain the estrogen level, and you have less amount of trouble during this transition phase. You're again back to square one. If you see, changes are happening at a rapid phase, and you are not able to handle it in spite of maturing, right? You are saying that you have matured now. As a little girl, even you are not able to handle. But right now what happens is, you have an added responsibility. You must be at the peak of your career at this age. Okay, you are handling so many things. It's not see, everyone cannot be a superwoman. I don't know why people use that word superwoman. A woman is a woman. Okay, and she has that superpowers. So for me, every woman is a superwoman. Okay, so you should not be in that competition. Yeah, I want to do this, I want to do that. No, wear loose clothings, light cotton, opt for natural fabric. You can do deep, slow breathing exercises. You can do yoga. Yes, yesterday we had a wonderful session by Yoga Hub people like Asha and Pallavi, ma'am, who said about how to cool your body during the menopausal changes. They talked about yogasanas, like, what we can do, like Shitkari, Shitali, Chandravedan pranayam, which helps to cool down your body, right? And even deep breathing exercises, like you can say 6 to 8 breaths per minute you can do, and it actually calms down your body, right? And yeah, in severe cases, obviously, you can say you have to relieve, like you have to go in for the hormone replacement therapy to relieve the mood disorders or maybe depression which comes up. You can always start with your hobby, or you can go out for a walk, chat with friends or with people with same interest. Avoid negative gossiping, I must say. Yeah. And vaginal dryness can be tackled, okay, effectively also in this age. You have low libido also. So at this age, your partner plays a very important role at every age, but at this age your partner plays a very important role, because even he is going through something called as andropause, a midlife crisis. So there should be a heart to heart talk with your partner, so that he's considerate about the changes that are taking place. It happens in many houses, मालूम है, ये पहले ऐसे नहीं थी, शांत बैठ के सब सुनती थी. ऐसा होता है, राइट? यू मस्ट हॅव हर्ड. ही पहिली अशी नव्हती, आता ती खूपच वैतागत असते सगळ्यांवर, सगळ्यांवर डाफरत असते. असं होतं. येस, दिस हॅपन्स. बट दिस इज व्हेरी नॅचरल. What she needs is the comfort, the consideration of her partner, of her daughter, son, and her family members to sail smoothly through this transition also. Because she has given maximum amount of time, energy, whatever, like, to be that in that role. She has been there with you. She has understood you throughout different phases of life. Now it is your turn to be her comfort partner, and that is very, very important. It is challenging, I know it is challenging, but it is important. Mayura, I just wanted to highlight about certain things, certain investigations, which at this age or maybe any age you can go. I'll just I'll just highlight about it. I just have a list which I'll read out. You have to go in through all the lipid profiles, the CBC, the glycosylated HbA1c, that is the average blood glucose level, the vitamin D and vitamin B12 levels as well. And there are certain investigations which are particularly done for females, like mammography. Okay, it is the screening of the breast. Okay, that is for early detection of the breast cancer. So it is mildly uncomfortable because there is compression of the breast. And in the 40s and 50s, you should actually go in for mammography after every 2 years. Okay. So that will, every third year, you can say. So that will help. You can start at age 35 if you have some history like of breast cancer. It is hereditary also in a way. So mammography, yes, I recommend mammography for every 40 plus female, 50s and 40s till that time. There is something called as pap smear, the papinicola smear that is called. Okay, it is a procedure to test for cervical cancer, because cervical cancer, the incidence of cervical cancer is also lying. Cervical cancer is the cancer of the mouth of the uterus. Okay, cervix. What basically happens is they scrap the cells from the cervix, the inner lining of the cervix, and they give it for testing. So the age group for that is 21 to 65 years. But the best age group, like if you're going it just for once or twice, WHO has recommended you go in between the age group of 35 to 45 for the pap smear. Okay. The ideal age is 21 years, and then you do it after every 3 years and all. Okay. Because, but then everyone doesn't go for it unless there is some history or this. And if you have certain problems like leukorrhea, in between bleeding, and something which comes up, or accidentally it may, like you may find up, or you may have some checkups. And pap smear generally people don't recommend, because directly don't recommend, because people don't come up. And but then that is an awareness that I want to generate. Yes, pap smear is a very good tool to diagnose cervical cancer at a very early age. Yes, and there is something called as cervical cancer vaccine. Yes, that has to be taken, because it is the easiest method to keep, to avoid that cervical cancer. And the best age group is 11 to 26 years, okay, before any sexual contact in females. So that is what, at every stage of life, as I said, iron rich food, calcium rich food, nutritious diet, take up a hobby, do physical activity, avoid negative gossiping, okay? And yes, do your work with dedication and have that optimistic attitude. Spiritually, also, if you develop yourself, you have that prayer, meditation, yoga, which comes up. There are many, it's not about YouTube videos or something, but if you do it in a group, also, it helps, that energy gets transferred. Okay. So basically, this is the journey, like from puberty to menopause, it comes up. And you should not regret, I have not done this, I have not done this. This is the phase where you can do things. Okay. Maybe you're financially stable or not, but you can do certain things. You can actually go out. You should not socially withdraw yourself. You should try out new things in this phase of life, right? I think I have summed up most of the things. Any questions here?
There is one question you have already answered, which was by Bhagya Lakshmi.
Hmm.
There is one more question from Supriya. So she
Hmm.
says that Dr. Rameshwari, please elaborate on diet of mainly puberty age group, because nowadays PCOD is on a high.
Yes, 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 yes. See, I always advise people, because PCOD, yes, weight management is very important in PCOD case. It's a vicious cycle. You increase your weight, you land up with PCOD. You have PCOD, you land up with increased weight. There is fat deposition. There is irregular periods. The home cooked food is the best food. Whatever is available locally, you can cook it. Not too much of fats, not too much of oily, spicy things. Dairy products, yes, dairy products and meat products, better in moderation you can have. Too much of dairy, or dairy products, or too much of, you can say, meat is not helpful in PCOS, to avoid. And yeah, if you have hypothyroidism, what we tell to avoid in diet is, because hypothyroidism, PCOS, these are all a symptom complex. Like, they are associated with each other. Pre-diabetes, hypothyroidism, weight gain, PCOS, all these are associated. In many females with PCOS, we have hypothyroidism, or maybe with hypothyroidism, you tend to get PCOS. Okay. So what we can avoid is, we tell if there is excess, like that the thyroid hormones are not in control, the hypothyroidism parameters, like that is there, plus. So we tell them to avoid broccoli, cabbage, plus even crabs, prawns. Okay, these are the things to avoid. Even soya beans we tell them to avoid, because the metabolism is slow. So we tend them to avoid this. And you should have iron rich food, green vegetables, sprouts, protein rich, iron rich foods, and keep your weight in control. So, and regular frequent meals. Intermittent fasting also helps, but you cannot tell younger females to do it, because they cannot handle that. Yes, and over the counter medications or medications, yes. This thing good. She asked about nutrition, no doubt. Even this fried food which we get outside, the fast food, the junk food, the Chinese food with that Ajinomoto in it, or maybe you have a lot of meat because that meat is from animals who are ingested with a lot of estrogen, progesterone, so many hormone injections for better, you can say, milk yield. Okay, that also is contributing to increase cases of PCOS nowadays and precocious puberty as well. Okay, so diet rich in calcium, iron. Okay, so it should be a full फ्लेज मील. जैसे हम घर में दाल चावल रोटी सब्जी खाते हैं, भाकरी इज देयर, वेजिटेबल्स आर देयर. अब अगर चना दाल भी खाते हो, इन एवरीथिंग इन मॉडरेशन, बिकॉज प्रोटीन आर द बिल्डिंग ब्लॉक्स. You need it plus in the growing years. Carbohydrates are energy rich foods, so you get it through all the dal, chawal, and whatever. Like pulses also are good source of proteins. See that you use unpolished dal. Don't use the polished dal. Okay, if you use tur dal or anything else, you there are ads also playing up. But I feel, because I personally use, I don't want to name thing, but I personally use unpolished dal. I'm not using any brand name, but I use unpolished dals, because you should not use that polished ones. They are beaten by leather belts, okay, and they lose all the. They are polished. They are beaten through leather belts. They go through a series of leather belts, and these dals are polished, and they lose their nutrition. So be specific about using unpolished dals, okay. And you can use mixed atta like jowar, bajri, wheat also this year. If you have some allergy to gluten foods, yes, wheat needs to be avoided. Bakery products also to the minimum. Okay, fermented food, yes, you can have, because then that is a very good thing. And Indian foods are fermented in a while. You can have buttermilk. Buttermilk also helps, aids in weight loss and in digestion also. And sprouts at regular intervals. Whenever you feel that वो चाट खाना है, तो थोड़ा सा sprouts आप बना दो. Onion, tomato, उसके साथ थोड़ा सा coriander. You can squeeze lemon. Even on dal and chawal, you can squeeze. You can just cut a dice of lemon and you can squeeze it, so that adds to your calcium absorption also. So all these things come into play, and I think PCOS diet, yes, diet is important at every stage, but PCOS, yes, not too much of fatty food. Okay, more of proteins, carbs, and physical activity, so that weight is managed. I think I've answered the question, Supriya. Any other question coming up?
No, these were the two questions actually. Many queries are actually taken care by the content which you
Yeah,
shared with
yeah.
us today, doctor. And it was really nice because I wanted every woman to understand this in a very quick format. Generally what happens is there are very elaborative sessions on each of this topic, and then sometimes it becomes like over information, and
Yes.
then this over information leads to a lot of confusion. So I mean, you putting it in a flow where these are the stages. So you have to firstly acceptance is something which is extremely important. And
Yes.
this is my appeal to every woman in the society, and people who will be watching this video a little later on also. You can have the options of moving ahead in the video, but I'm sure that the part which is important for your life stage just now in this video, please hear it carefully. These stages are extremely important, and my other appeal is to the audience who are supporting the women today, the family, the male members, not only in the family, in the relation, in the friend circle, in the society, that please, when you come across a woman, I know women never like to tell their age or display their age, but yes, there are certain major reasons behind a woman's behavior at every stage of life. And this acceptance has to come from the society and from the family. So, Dr. Rameshwari, thank you so much for this elaborate and yet, nice summarized session of this entire journey which a woman goes through. and we hope that it is really helpful to our viewers and all those who are going to listen to this video later on. If you have any queries, Dr. Rameshwari has left her contact for you. There is her Gmail also, so if she's in some emergency or in the hospital, she might not be able to pick up the call, but you can leave her a Gmail and she will definitely answer your query. So, Dr. Rameshwari, wishing you a very, very happy Navratri, and thank
Thank you.
you for sparing such a lovely time for our viewers. Thank you so
Thank
much.
you. I'm honored and privileged to share. You gave me this platform to share, and I'm happy that like I can come online now. Through Banyan Minds or
Yes,
any. But yes,
yes,
this was the first time that I have come up because I was doing to physical presentations, and during COVID times it had stopped for a while. Okay, so any health talk show or any presentation to be given, you can contact me.
sure.
You can have a closed group also, and we
Yes,
do heart to heart. Like you talk in Marathi or in English, in whatever language you prefer. But in Marathi and English, I prefer Hindi. Also, I can give the presentation, so that helps because everyone cannot comprehend this language. English is just a language, right? Yes, and it can be done with a closed group also. And you can contact me for it or any other queries. You can drop it in the chat box or maybe an email, and I'll reply to it in next 24 hours, the coming 24 hours. Okay. So anytime you can just watch the video, and any other topics which you would like to hear, please let me know. Okay. Thank you. Happy Navratri.
thanks. Thank you, doctor.
Thank you. Thank you. किती लोकांनी बघितला कसं कळेल चांगलं झालं